What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe, new videos coming every week, you don't want to miss them. In this video today, I'm actually going on a job interview. After your residency, you do your 4 years of medical school, anywhere between 3 to 7 years of residency. And then most people do a fellowship. I'm doing a 1-year fellowship in spine surgery. And then after fellowship, after all those years, this is when you can finally start searching for your first job as a doctor. Really exciting time, but really stressful time as well. I just wanted to make this video kind of about my experiences going on my first interview as a doctor, looking for a doctor job or a job as a surgeon. So luckily, that interview is here in town in San Antonio, Texas. I'm actually interviewing with a group here in town. But I wanted to talk about some of the things that kind of came across my mind. Also, when I reached out to my mentors, they told me this is what you should be looking out for. This is what you should ask. I wanted to talk about those things. So, after your residency, towards the end of it actually, there may be certain individuals or groups are say for orthopedic surgery, there may be 10 or 15, 20 different groups of surgeons here in town, and they basically practice together. So I have another video about academic medicine versus private practice, and I'll put that up. But in general, most people kind of take that path, and there's a couple other paths you can do solo, you can do hospital employee, private practice or academics are kind of the main two types, but I'm leaning towards private practice primarily because I'm not really big into research, and also I'm more of a business type person. And that's not to say that being in academics, you can't do business on the side or you can't have anything else associated with, outside of academics. But me, I think private practice kind of fits my kind of personality, who I am. So I'm going down the private practice route. I'm actually going to join a group of another group of surgeons who are in private practice as well. Or some people start their own practice, start their own business, and that takes a lot of work as well, a lot of extra money. So I didn't feel like that was the best thing for me. So starting off, I feel like when you're trying to decide, I think it's important to decide between academic and private practice. But once you choose that, then that's when you start your job search. So some groups will reach out to you towards the end of your residency or the end of your fellowship and say, hey, we would love you to come join our group. And other times you're reaching out to that group and saying, hey, I'm a plastic surgeon. I'm actually coming out of fellowship and I'm well trained. So, and I'm interested in joining your group because of this. And after that, you guys come together and you meet. It's sort of like an interview. You interview them, they interview you. Just basically trying to figure out whether you're a good fit for each other. Some things that are discussed in these meetings are pay, whether you're going to be paid their salary or eat what you kill, meaning that you will make money only if you operate or see patients in clinic or do certain procedures, or whether you'll be a salary-based type income, which means that you will get a certain salary no matter how much surgeries you do. But for the most part, it's usually eat what you kill. So in private practice, the more surgeries you do, the more procedures, the more patients you see, the more money you'll make. The other things that are discussed are, is there ownership in the group? Can I become a partner? What is the call schedule like? How often will I be on call? Who will be sending me patients? So as a, say for instance, endocrinologist, you want to know who will be sending me new patients, consults, so I can bring in more money and see more patients and help the overall group overall. Other things that are discussed are like malpractice insurance, whether they will cover certain parts of that, and there's lots of different types of malpractice insurance and stipulations in different types and things that go along with this. Very confusing and very complex, and I'm still learning about all of this. You guys will discuss lots of other things about their practice, like how many people are in your practice, what will your first 2 years look like, So lots of different things that are discussed in these meetings, and basically you just come up with a plan and you figure out whether you two are both a match for each other. So I have my first one today, and after the interview, I'm going to let you guys know how it went. So hang tight and I'll check in with you guys after the interview. All right, so I just got out of the meeting or the interview, and I think things went well. Some of the things that we talked about was contract overhead, which is how much you will have to pay each month. So when you join a group or you have a business, you have to pay for the employees, you have to pay for the office space, even everything from the paper, the pens that you use, the printers, all of those things. So it is dark outside. Actually, I was been kind of tied up for the last few hours. They actually took me out to eat. I went to go visit a hospital, met the CEO of that hospital. So that's why it took so long to actually check in again. But I think things went well. We also talked about what kind of things I should focus on during my fellowship year, such as should I focus on learning how to do certain procedures or certain innovations that I should try to bring to the table. We talked about pay, we talked about call. I want to do some regular general orthopedic call, so even as a spine surgeon for the first few years, I want to take, if a patient comes into the ER who breaks their ankle, I want to take care of that patient and do their surgery just to build my practice. We talked about a lot of different things, and I think it went well. So some things, I think it's important to ask a lot of questions, know what you're getting into. It's a two-way streak. They are interviewing you and you're interviewing them. So you got to have a lot of questions to ask them. You have to know what they're looking for. You have to know what you're looking for, so to make sure that you guys are a match. So I think things went well. In the next few months, I'll be slowly searching to see what else is out there in terms of contracts, in terms of different job offers and different locations. But I think if you know where you want to go, say for instance, I want to live in Minnesota, that makes it a lot easier versus saying, oh, I would go anywhere. So you have offers from all over the place. So I think it's a lot more challenging to do it that way. But thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. We'll see you next time.